Welcome back to the Microlearning Credential on Effective Healthcare Waste Management. This is Module 3 of the course, Hazards Associated with Healthcare Waste. In this module, we will study the different types of hazards of healthcare waste, and its impact on public health. We will also study who are mostly at risk. Let us begin with the different types of hazards of healthcare waste. Safia now has a better understanding of the different healthcare wastes generated in her healthcare facility, but before diving into the management and disposal procedures, there's one more thing she wants to understand. She wants to know the potential hazards of these wastes so that she can handle them safely. Safia recalls that healthcare waste is hazardous due to the presence of following characteristics. Presence of infectious agents like bacteria, virus, fungi in used dressing and personal protective equipment. Presence of toxic chemicals used in pharmaceuticals and lab reagents. Genotoxic or cytotoxic chemicals in pharmaceuticals. Presence of sharps like needles, syringes, blades, etc. Presence of radioactive chemicals like chemotherapy refuse, certain lab chemicals, and waste management practices and procedures that can cause damage. Let's understand the hazards related to each type of waste with Safia. Healthcare waste contains a multitude of infectious agents which can have a serious effect on anybody who comes in contact with the waste containing it. These pathogens can enter the body from different routes like abrasion on the skin, mucous membranes, etc., and can have mild to severe deteriorating effects on health. People who live close to landfills where infectious healthcare waste such as face masks, used syringes are dumped, are at a higher risk of developing infections like tuberculosis and skin disorders due to the presence of pathogens around the waste handling sites. Chemicals found in healthcare waste can be intoxicating due to the presence of heavy metals, carbon compounds, and reactive elements that can cause physical injury due to one-time or prolonged exposure. In addition, due to the flammable and corrosive characteristics of some chemicals like lab reagents, any contact with them can prove dangerous. Pharmaceuticals have active chemical compounds which, if not contained during disposal, can seep into the surrounding environment. A recent case of gas leak happened in the USA at the Ascension St. Elizabeth Hospital in Appleton. 13 patients who came in contact with the chemical gas suffered poisoning and suffocation, therefore had to be transferred to other local hospitals. Genotoxic waste is highly hazardous and may have mutagenic, teratogenic, or carcinogenic properties. Its exposure can happen through inhalation of cytotoxic chemicals, contact with body fluids and secretions of patients undergoing chemotherapy. In extreme cases, it can prove fatal. Contact with genotoxic waste can occur during drug preparation or treatment with certain chemicals. Sharps can be dangerous as they can cause injury resulting in minor to major cuts. The main risk of a sharp injury is the potential exposure to infections. HIV can survive in a used syringe for up to 42 days, depending on temperature and other factors. A study conducted among healthcare workers in Wolaita Zone, southern Ethiopia, revealed that 55.1%, 343, of around 623 healthcare workers in the region were injured by needle sticks in the past 1 year. The level of needle stick and sharps injuries was therefore high. It was inferred that training is required in the prevention of needle stick and sharps injuries to healthcare workers. Essential and consistent wearing of gloves was made mandatory. Radioactive waste containing traces of radioactivity can come in many forms: syringes, needles, cotton swabs, vials, contaminated gloves, absorbent materials, medical equipment contaminated with trace amounts of certain isotopes, and the radiation source for radiation therapy. Exposure to large amounts of radioactivity can cause nausea, vomiting, hair loss, diarrhea, hemorrhage, destruction of the intestinal lining, central nervous system damage, and death. It also causes DNA damage and raises the risk of cancer, particularly in young children and fetuses. A notable case of radiation accident happened in June 2019, where radioactive powder was spilled at University of Washington and Harborview Medical Center building, contaminating the whole building. The leak happened when a federal subcontractor was removing a machine called an irradiator from the building. It was being used to sterilize blood. The buildings were closed for months for radiation cleanup and testing. In addition to specific hazards posed by different types of healthcare waste, occupational malpractices associated with healthcare waste management can cause ill effects on those in contact. Flue gases and ash from waste incinerators can pose a risk of contamination and injury to health workers. Burnt-out needles and glass may have been disinfected but can still cause physical injury. Autoclave and steam disinfection treatment methods pose potential hazards that need to be managed. In particular, good maintenance and operation should be undertaken to avoid physical injuries from high operating temperatures and steam generation. A study conducted in South Africa examined the prevalence of latex allergy and sensitization after the introduction of hypoallergenic powder-free and lightly powdered latex gloves in some hospitals. The prevalence of latex sensitization and allergy was observed among exposed workers, 7.1% and 5.9%, and unexposed workers, 3.1% and 1.8%. The authors concluded that healthcare workers exposed to hypoallergenic latex gloves are at risk for developing latex sensitization, highlighting its importance as an occupational hazard in healthcare. This study also showed that the risk of latex sensitization decreases with duration of employment. After reading the manual on the hazards of waste, Safia clearly understood the harmful effects of healthcare waste on herself, her colleagues, and the general public. She gets motivated to manage the waste generated in the hospital in the appropriate way. Have you witnessed any of these hazards at your workplace?